Today, we're going to tackle some of the most complex and often misunderstood conditions out there, eating disorders. Our goal is to break down 4 of the core types into clear, understandable concepts. By the end of this, you'll have a solid framework for telling them apart. Let's jump right in.
So here's the big question. Where is the line? When does a complicated or even difficult relationship with food cross over into something that's a clinical disorder? Knowing exactly where that line is changes everything, not just for clinicians, but for anyone who might be struggling. That's why getting the definitions right is so important. So, to find those definitions, we're going straight to the source, the official clinical manual, the DSM-5-TR. We're going to zero in on 4 specific disorders, and you're going to see that each one has its own unique fingerprint.
Now, what I really love about the material we're working from is how it gives each disorder a simple, memorable phrase, an anchor that kind of locks in its most essential feature. We're going to use these anchors as we go because they're a fantastic tool for remembering the key differences.
Okay, first up, we're looking at 2 disorders that, on the surface, can seem really similar. Why? Because they both revolve around restriction. But as you're about to see, the reason for that restriction is what makes them worlds apart. Let's start with ARFD, and the anchor for this one is absolutely critical. A person with ARFD avoids or restricts food, but, and this is the key, it has nothing to do with body image, fear of gaining weight, or wanting to be thin. The reason is completely different. It might be about sensory stuff, like textures they just can't handle, or a genuine fear based on a past choking incident, or sometimes just profound lack of interest in food. This quote is a perfect window into that mindset. You see how the focus is all on the food itself, or the physical act of eating? They're talking about textures, colors, a specific fear. There's no mention of feeling fat, or calories, or anything about body shape. That's a huge clue. And that's the perfect pivot. What happens when the restriction is all about body image? When that fear of gaining weight is the driving force? Well, then we're in a totally different ballpark. And that ballpark is anorexia nervosa. This one really stands on 3 pillars. First, there's restriction of food that leads to a significantly low body weight. Second, there's this intense, powerful fear of gaining weight. And third, there's a serious disturbance in how they perceive their own body. Those 3 pillars map directly onto the formal criteria. You need all 3. But I want to stress criterion A. That significantly low body weight part, it's not optional. It is an absolute requirement for the diagnosis of anorexia nervosa. This quote, it just gets right to the heart of that 3rd criterion, the body image distortion. It's this powerful disconnect between what is real and what the person feels and sees. It isn't just about feeling insecure, it's a core feature of the illness that fuels everything else. All right, let's shift gears completely. We're moving away from restriction as the primary feature and into a pair of disorders that are anchored by something else, binge eating. But the real difference between these two isn't the binge itself, it's what happens after. So first we have bulimia nervosa. The key thing to remember here is this 2-part cycle. It kicks off with a binge eating episode. That means eating a very large amount of food and, crucially, feeling a complete loss of control while doing it. Then that episode is followed by what's called a compensatory behavior, basically an attempt to undo the binge, like self-induced vomiting, fasting, or exercising excessively. And for this to be a clinical diagnosis, we're not talking about a rare occurrence. This binge and compensate cycle has to be happening, on average, at least once a week for 3 months straight. It's a relentless, distressing pattern. This statement really captures the whole experience. That feeling of being out of control is often terrifying, and it's followed by this wave of shame and guilt. That shame is what drives the need to compensate. And because people with bulimia are often at a normal or above normal weight, this whole cycle can be a secret they carry for years. So what if you have the binge episodes, but you don't do anything to compensate? Well, that brings us to our 4th disorder, binge eating disorder, or BED. The person here has those same recurrent binges, that same feeling of losing control while eating, but there are no compensatory behaviors afterwards. This quote gets to the emotional core of BED. That marked distress from the definition is huge here. Instead of trying to undo the binge, what follows is just intense guilt, shame, or disgust. And that shame often leads to eating in secret, which just feeds a cycle of isolation. Okay, we've met the 4 disorders. Now for what I think is the most important part,
drawing those sharp, clear lines between them. This is where we're going to clear up all the common mix-ups.
Let's start with bulimia versus binge eating disorder. Honestly, the difference couldn't be more clear-cut. They both share binge eating. The one and only dividing line is compensatory behavior. If it's there, it's bulimia. If it's not, it's binge eating disorder. That's it. It's that simple.
Okay, now for a trickier one. What if someone binges and purges? Is it anorexia or bulimia? The answer comes down to one single factor: their body weight. If the person is significantly underweight, the diagnosis is always anorexia nervosa, even with binging and purging. If their weight is in the normal range or higher, then it's bulimia. The weight is the tiebreaker.
And let's circle back to our very first pair, ARFID and anorexia. Both can lead to serious food restriction and weight loss. But the dividing line, again, is crystal clear. It's the motivation. Is the person restricting because they're terrified of being fat or hate their body shape? If the answer is yes, we're looking at anorexia. If it's no, and it's all about sensory fears or lack of interest, we're looking at ARFID. The why behind the behavior is everything.
Whew, we have covered a lot of ground. So let's bring it all home and wrap this up with one final look at those 4 simple, powerful anchors we started with. If you remember just one thing from all this, make it this table. These are your anchors. For ARFD, it's avoiding food for reasons that are not about body image. For anorexia, it's restriction leading to a significantly low weight. For bulimia, it's the binge plus the compensation. And for binge eating disorder, it's the binge with no compensation. These 4 simple phrases are your cheat sheet for telling these conditions apart. And that's why all of this matters so much. Getting the label right isn't just some academic exercise. It's the absolute first step toward getting the right kind of help, because each of these conditions needs a different path to recovery. It really makes you think, doesn't it? What other complex parts of our world could use this kind of clear, anchor-based thinking to make sense of them? Thanks so much for joining me.